Let's begin with a story about a 65-year-old woman. For years, she had been living with a constant nagging pain in both of her knees. This was not a new problem for her. It had been a companion for a long time. The pain was caused by osteoarthritis, which is a very common condition where the protective cartilage in the joints wears down over time. This meant that every step, every movement was a source of discomfort. Her daily life was significantly affected. Simple activities like walking to the shops, climbing stairs, or even just getting up from a chair became difficult and painful challenges that she had to face every single day, which really took a toll on her independence and quality of life. Like many people in her situation, the woman first turned to conventional medicine for help. Her doctors prescribed the standard treatments for osteoarthritis. She started with painkillers to manage the constant ache and reduce the inflammation in her joints. When the pain became more severe, she received steroid injections directly into her knees. These injections can provide temporary relief by reducing swelling and pain. For a while, these treatments helped her cope. However, the relief was often short-lived. The pain would always return, sometimes even worse than before. She grew frustrated with the cycle of temporary fixes and the side effects of long-term medication use. The continuous use of painkillers brought its own set of problems. The woman worried about the potential impact these drugs could have on her stomach and kidneys over many years. The steroid injections also had their limits. They cannot be given too frequently because they can weaken the joint tissues over time. Faced with these limitations and the prospect of a life filled with persistent pain, she felt she was running out of conventional options. The idea of undergoing major surgery, like a total knee replacement, was something she desperately wanted to avoid. This feeling of being at a dead end made her start looking for other possibilities, something different that might offer a more lasting solution. This search for an alternative led her to explore treatments outside of mainstream medicine. She was looking for hope, a new path that might free her from the daily struggle with her arthritic knees. Her journey is a common one for many individuals who live with chronic pain. When standard medical treatments fail to provide satisfactory or long-term relief, people often become more open to trying unconventional therapies. In her case, she heard about a procedure that sounded both unusual and promising, an ancient practice that involved using real gold to treat joint pain. It sounded like a magical solution, and her desperation made her willing to give it a try. The alternative treatment the woman chose was gold thread acupuncture. This is a very specific and uncommon type of therapy. It is not like regular acupuncture, which uses thin needles that are removed after a short session. Instead, this procedure involves implanting tiny, sterile pieces of gold thread, often just a few millimeters long, into the soft tissues around the painful joint. The idea is that these small pieces of gold will remain in the body permanently. The practitioners of this therapy claim that the gold provides continuous, gentle stimulation to the acupuncture points. This constant stimulation is believed to reduce inflammation and provide long-lasting pain relief, far beyond what a normal acupuncture session could offer. The theory behind gold thread acupuncture is based on traditional beliefs combined with some modern ideas. The practitioners suggest that the presence of gold in the tissue creates a mild, ongoing anti-inflammatory reaction. Gold itself is known to be non-reactive, which is why it's used in dentistry and other medical applications. The thought is that this non-reactive metal can somehow calm the overactive immune response that contributes to the pain and swelling of osteoarthritis. For someone who had tried everything else without success, this explanation offered a glimmer of hope. She decided to go ahead with the procedure, believing it might be the answer she had been searching for to finally end her chronic knee pain. So, the woman underwent the treatment. Small fragments of gold thread were carefully inserted around both of her knees. For a time, she felt that the procedure had worked. She reported that her pain had lessened, and she was able to move more freely than she had in years. This initial success made her a firm believer in the alternative therapy she had chosen. She was happy that she had taken a chance on something different. However, this period of relief did not last forever. Many years later, the severe pain in her knees returned, and this time, it was worse than ever before. She found herself back where she started, once again seeking help from the medical system she had previously left behind. When she returned to the hospital, her case presented a new and unusual puzzle for the doctors. She explained her long history of osteoarthritis and the various treatments she had tried over the years. Crucially, she also mentioned the gold thread acupuncture she had received almost a decade earlier. This piece of information was vital for the doctors to understand what they were about to see. Her journey from conventional medicine to an alternative therapy and back again highlights the complex decisions patients make when dealing with chronic illness. It also set the stage for a surprising discovery that would complicate her future treatment options and serve as a lesson for others. When the doctors ordered X-rays of the woman's knees, they were met with a startling sight. The images clearly showed dozens of tiny, bright white lines scattered throughout the soft tissues surrounding her knee joints. These were the gold threads that had been implanted years ago. Because gold is a dense metal, it shows up very clearly on an X-ray, appearing as bright, radio-opaque fragments. The threads looked like a shower of tiny metallic needles embedded deep within her flesh. While the woman had told them about the procedure, seeing the sheer number of fragments on the X-ray was still a shock. It was a visual confirmation of the unusual treatment she had undergone, a permanent reminder embedded in her body. The presence of these gold threads created a significant problem for the medical team. The main purpose of getting an X-ray or an MRI scan is to get a clear view of the bones and soft tissues, like cartilage and ligaments. However, the hundreds of gold fragments created a scatter effect on the images. This means they produced visual artifacts like bright streaks and shadows that obscured the very structures the doctors needed to examine. It was like trying to look at a detailed map that had been covered in glitter. The gold threads made it incredibly difficult to accurately assess the extent of her osteoarthritis or to look for other potential problems, such as fractures or tissue damage. This issue became even more critical when considering the best long-term solution for her pain: a knee replacement. Before such a major operation, surgeons need highly detailed images of the joint to plan the procedure meticulously. They need to measure the bones precisely and assess the condition of the surrounding tissues. The gold threads made this impossible. Furthermore, MRI scans, which provide the best images of soft tissues, were completely out of the question. The powerful magnets in an MRI scanner could potentially heat up the metal threads or even cause them to move, which could lead to serious internal injury. She was, in effect, blocked from receiving the most advanced diagnostic imaging. Another worrying possibility was that the threads themselves could move over time. The body does not always keep foreign objects in one place. These tiny gold fragments could migrate through the soft tissues. There have been documented cases where these threads have moved into the joint space itself, causing mechanical problems and further damage. They could also move closer to major nerves or blood vessels, creating new and dangerous health risks that were not part of the original problem. The permanent nature of the treatment, once seen as a benefit, had now become a significant and potentially hazardous complication for her future medical care. Based on cases like this one, the medical community generally advises great caution when it comes to gold thread acupuncture. There is a lack of strong scientific evidence to prove that it is either safe or effective for treating osteoarthritis. While some people, like the woman in our story, may experience temporary relief, this could be due to a placebo effect. The placebo effect is a powerful phenomenon where a patient feels better simply because they believe the treatment is working. The risks, however, are very real and well documented. As we have seen, the threads can interfere with essential medical imaging, which is a major drawback for future care. Doctors and health organizations strongly recommend that patients stick to evidence-based treatments for osteoarthritis. These include lifestyle changes like weight management and physical therapy to strengthen the muscles around the joint. They also include proven medical treatments such as anti-inflammatory medications and, when necessary, steroid injections administered under professional guidance. For severe cases, joint replacement surgery remains the most effective long-term solution for relieving pain and restoring mobility. These treatments have been rigorously studied over many years and have a well-understood record of safety and effectiveness, which is something that cannot be said for gold thread implantation. The story of this woman serves as a powerful cautionary tale. It highlights the importance of making informed decisions about your health. It is completely understandable to feel desperate when you are living with chronic pain and to search for any possible source of relief. However, it is crucial to be wary of treatments that lack scientific backing and sound too good to be true. Always discuss any alternative therapies you are considering with your doctor. They can help you understand the potential risks and benefits and guide you toward choices that are both safe and effective, ensuring that you do not accidentally compromise your future health options. In the end, the key takeaway is the importance of a partnership between patients and their healthcare providers. While exploring all avenues for treatment is natural, this should be done with open communication and a critical eye. Unproven therapies can sometimes lead to unforeseen and irreversible complications, closing doors to the very best that modern medicine has to offer. Being a well-informed patient means asking questions, weighing the evidence, and prioritizing safety above all else. This approach ensures that the path you choose to manage your health is one that truly supports your long-term well-being, without adding new and unexpected problems along the way.